Good afternoon, everybody. I'm Sharon Bogan from Public Health Seattle and King County Communications. Thank you all for joining us today, particularly on short notice. We wanted to update you all on monkeypox case in King County, and we'll turn it over to Dr. Jeff Duchin, Public Health Officer for King County.
Thank you, Sharon, and thanks all for joining today. Public Health, Seattle and King County, with support from our colleagues at Washington State Department of Health, is investigating a presumptive case of monkeypox virus infection that was reported to us yesterday. The case is an adult male with international travel in the past month to a country that has also reported monkeypox cases recently. Initial testing confirming orthopox viral infection was completed earlier today at the Washington State Public Health Laboratory, and confirmatory testing will be done at the CDC. And our team is working with the patient and the patient's healthcare providers to understand whether there are individuals who may have been in contact with the patient while he was infectious, and the individual himself is isolating and does not pose a risk to others. We have not identified any high-risk exposures in King County, and we are following up with the people who had potential low-risk exposures. This individual was not hospitalized, and he's recovering at home. As of this morning, I heard on the CDC briefing, and many of you may have as well, that in addition to this case, the CDC is aware of 1 confirmed and 4 other presumptive monkeypox cases in the US. Over 100 confirmed and suspected cases have been reported from the UK and Europe, where health officials report many cases among men who have sex with men and likely sexual transmission. Locally, I want our public and healthcare providers to be aware of the growing international monkeypox outbreak. At this time, we have no evidence that monkeypox is spreading locally, but if there are unrecognized cases, that could be a possibility. And I would not be surprised if we see more cases, either travel associated or from unrecognized local spread. So people should understand that this disease can affect anyone, and that those who are most at risk are those who have had close physical contact with someone with monkeypox. The risk is not limited to men who have sex with men. For that reason, anyone who has symptoms of monkeypox or who has been in contact with someone with monkeypox should be evaluated by a healthcare provider. And this is especially important for those who've traveled in the last 30 days to a region reporting monkeypox cases, or who is a man who has sex with other men. Let me say a few words about monkeypox. This is a rare viral illness that's uncommon in the US. The illness can begin with flu-like symptoms and swelling of lymph nodes, followed by a rash on the face and body, or, and this is important, with an isolated rash in the genital or groin area, not a rash on other parts of the body. And some may present with a rash in the genital or groin area without other symptoms. And this can be mistaken for other common sexually transmitted infections. So when the rash begins in the groin, it may be something that someone may seek healthcare thinking they have a sexually transmitted infection. And we want our healthcare providers to think of this when they're evaluating patients for possible sexually transmitted infections. So I want people in the community to be aware of this outbreak and to be alert for the appearance of new rashes that are characterized by sores or bumps or fluid-filled bumps. It can look like chickenpox rash, and to seek medical evaluation if they develop such a rash. Now, most people recover in 2 to 4 weeks, but the disease can be serious, especially for immunocompromised people, children, and pregnant women, the same groups that are vulnerable to many infectious diseases. The virus does not spread easily between people, and transmission can occur through contact with body fluids, with the sores, with the rash itself. Items that have been contaminated with fluids or sores, like clothing or bedding, can be infectious, and respiratory droplets like saliva from a case that enters the eyes or mouth following prolonged face-to-face contact. Monkeypox is a disease that's been recognized since 1958, and we have a decent amount of experience in literature, we meaning humanity, with outbreaks, and this does not a disease that spreads readily from person to person without the factors that I've mentioned. So for the public, I would like people to contact their healthcare provider if they have symptoms of monkeypox, especially if they've traveled to Central or West African countries or parts of Europe where monkeypox has been reported, or other areas with confirmed cases of monkeypox in the month before their symptoms began, or if they've had contact with someone with a confirmed or suspected case of monkeypox, or is a man who regularly has close or intimate contact with other men, including through online websites, digital apps, or other gatherings. For our healthcare providers, I'd like our clinicians in the community to consider the diagnosis of monkeypox in people who present with an otherwise unexplained, but not exclusively, let me start over there. I would like our clinicians to consider a diagnosis of monkeypox in people who present with an otherwise unexplained rash and who have traveled in the last 30 days to the country that has recently had confirmed or suspected cases of monkeypox, or who report contact with a person or people with confirmed or suspected monkeypox, or who is a man who reports sexual contact with other men, but not exclusively to suspect only in those groups, but in anyone who presents with the clinical syndrome that could be monkeypox: fever, feeling achy, headache, and swollen glands and new rash, or any combination of those symptoms. And here in King County, patients can be evaluated at the Public Health Seattle and King County Sexual Health Clinic, which is open Monday, Wednesday, Thursday, and Fridays from 7:30 a.m. to 6 p.m. and Tuesdays from 9:30 a.m. to 6 p.m. And for our healthcare providers, we ask that you please report suspected cases to us right away at our usual report line number. So with that, I welcome any questions.
Thank you so much, Dr. Duchin. And for media who are attending, you can raise your hand, and then I will unmute you. And if you can also let us know your news outlet, that's always helpful for us. So let's take some questions. Nick Papa, you can go ahead.
Hi there, Dr. Duchin. Thanks so much, as always, for taking time out for us. My first question was, how concerned should people in King County be right now when it comes to this discovery of monkeypox, or preliminary discovery? And then also, how difficult is it to do the tracing or figure out who's been in contact with this specific person, especially considering that we're still dealing with a rise of COVID cases?
Yeah, so should people be concerned, or how concerned? People should definitely be aware. And if they have the risk factors that I mentioned, particularly if they have symptoms of monkeypox, they should be concerned and they should seek medical evaluation. If they've traveled to an area where monkeypox has been reported, or they've been in contact with someone who's suspected to have monkeypox, or for men who have sex with men, the level of concern should be a little bit higher, and they should be on the lookout for those symptoms and seek evaluation. If you don't have those risk factors, you should be alert and aware, but I wouldn't be overly concerned at this time. This is one case. Again, we have no evidence of spread within the county. We have a very cooperative patient who's been working with our team, and we believe we know everyone that he's been around during the time when he could have spread the infection. We don't believe there were high-risk exposures. We'll be monitoring those folks, and we'll definitely keep you updated if we learn new information or if anything changes.
And sorry, Dr. Duchin, one more question for you. Is it primarily spread through sexual contact, and why specifically men-on-man sexual contact that you've been specific in noting to look out?
So monkeypox is primarily spread through direct contact with the skin lesions. That is how at least monkeypox is spread primarily in the US. In Africa, you can acquire monkeypox from animal reservoirs, like through a bite or preparing meat from bushmeat animal, or other exposures to animals, caring for animals, and so on. But what we're talking about here is person-to-person spread, and that is primarily through contact with the infected rash. So if if you've got close contact with that rash, regardless of where that rash is on the body, That's the most effective way the infection will spread. This particular cluster that's been reported happens to include, and when I say this, I'm talking about internationally now, this cluster of international cases, 100 plus confirmed and suspect, happens to include a significant number of men who have sex with men, and they are presenting with lesions on the genitals that look like or are assumed to be sexually transmitted because that is the skin that's involved in those cases. Monkeypox can also be transmitted through clothing or sheets or bedding or other things that can become contaminated with the fluid from the rash. So, theoretically, if you're caring for someone who had monkeypox, you'd want to be careful in handling their linens and so on. And then it can also be spread through prolonged face-to-face contact from saliva that might get from someone's mouth into someone else's eyes or mouth if they coughed or sneezed, for example, into their face.
Thanks so much, Dr. Duchin. We can take a question from Joel Moreno.
Thank you, Dr. Joel Moreno, Como TV. I have two questions. One, the people that you're monitoring for low risk exposure or high risk, any details about them as far as like how many that is or where the exposures may have happened, like SeaTac Airport? And then the second question is, how much protection does the public have from if we've had our smallpox vaccine, and would we need boosters for that, or?
Okay.
Yeah.
Yeah. So with respect to the investigation, how many people, we are still working this up. It just was reported yesterday, so I don't think I can give you a definitive number, but the case did travel. And so we've alerted the CDC and the Division of Quarantine and Global Migration. And as I said, the case is very cooperative about providing travel details. So the CDC will follow up on travelers, international travelers. We will be following up on people who are here in Seattle and King County. And those include some of the close contacts of the case. I don't really want to get into too many details that might lead to identification of this person, but I can just tell you a relatively small number, less than a dozen close contacts have been identified at the moment. But we're still working, to make sure we have identified everyone where this person may have been during their exposure period. But based on the activities that this person was doing, we don't suspect that there are high-risk exposures that we're missing at this point. With respect to smallpox vaccination, smallpox vaccination does provide some protection against monkeypox, although most people, younger than 60 or 50 for sure, have not been vaccinated against smallpox, but the older adults would have some protection most likely if they are exposed to smallpox or monkeypox even 20 plus years later. But that is not, something that is routinely administered anymore because smallpox, which is a horrible disease that killed up to 30% of those who are infected, has been eradicated through the use of smallpox vaccine. So that's a great public health victory. In this case, smallpox vaccine, well, I'm sorry, my puppy, hang on one second. Okay. In this case, smallpox vaccine could be used for high risk exposures, particularly in people who are susceptible to severe illness, such as immunocompromised persons or healthcare workers who didn't take the appropriate precautions and so on. But we have not identified any such exposures that would require a post-exposure vaccination at this point.
Thank you. We can take a question from Evan Bush. You can go ahead.
Thanks so much. I was just wondering if public health or providers in the area that public health is aware of had requested the Jynneos vaccine for anyone, whether close contact or anything like that.
Evan, we have not identified any exposures that would merit post-exposure vaccination at this point.
Thank you.
Great. I'm not seeing any additional questions, but I'll give one more minute in case there are a few folks who haven't had an opportunity. Great, we've got one more here. Callie Greenberg, you can go ahead.
Great. Hopefully you can hear me. Just a perspective question, having been through a pandemic now, when people hear the word monkeypox and they hear of another virus, people's brains start spinning. Can you just give us big picture perspective? What do we anticipate this looking like in the weeks and months ahead?
Mhm. Yeah, well, this is unusual, I would say. Monkeypox is a disease that is familiar in that it's been recognized, as I said, since 1958, and there have been numbers of outbreaks, both in Africa and smaller outbreaks outside of Africa. We've had an outbreak in the US, for example, in 2003 that was related to the importation of pets that were infected. And that led to many infections here, but I don't believe there was any person-to-person spread among those cases. So, I mean, this is a known virus that is now doing something a little bit unusual and causing this type of outbreak in multiple countries at the same time, and apparently significant amount of person-to-person transmission. I think what this means in the big picture is that, we live in a world with lots of other microbes. And, at times they do things that are puzzling to us. They emerge into our world unexpectedly, and sometimes they change the way they have appeared, or they appear in new ways based on either changes that occur to the bug or the ways that we interact with one another and give more opportunities for bugs to spread. And that is a little bit probably of what we're seeing now, and that I would expect to see increasingly in the future as, just people in general encroach more and more on habitat where some viruses and bacteria, fungi, other pathogens may be living, and we have more opportunities to become infected and then spread those to one another. So I think, the big picture here is this is, it's an unfortunate coincidence that we're having a novel monkeypox outbreak. At the same time, we're still grappling with a large scale COVID-19 pandemic. However, at this point, although I would not be surprised to see additional cases of monkeypox, I don't think that poses anywhere near the threat that COVID-19 poses to us. I don't think we'll see the levels of transmission. I think it will ultimately be brought under control. People can isolate themselves. It's not an airborne disease, so people get symptoms. They can isolate themselves, and you have a skin rash. That's how it spreads. If you're not in contact with other people when you have your skin rash, it will not spread. So I think it's a much easier disease to control just from the individual perspective and from the population health perspective. So, I can't predict how this is going to play out. I think, as I said, we may see significant number of additional cases, but I don't think it's going to be, another global pandemic, anything like what we're seeing with COVID-19. But as we've learned with COVID-19, you can't always predict what's going to happen in the future. That's just my best guess.
Thank you. We have a question from Jeff Fajola. You can go ahead.
Yes, thank you so much for taking my question. Can you talk about the lethality of this virus? How deadly is it in kind of relative to COVID as you've been talking about?
Yeah, so there are two major strains of monkeypox virus, Congo Basin strain and West African. And the genetic sequencing, the limited number of sequences that have been made available so far, show that this is a descendant of the West African strain, which has a lower case fatality rate, around 1% perhaps. Ballpark in previous outbreaks might be much lower in this context, and I don't expect that we're going to see anything nearly as severe as COVID-19. Most of the cases that have been described have either been described as mild or moderate. I haven't seen reports of patients truly needing hospitalization, no deaths. At least so far, the personal health impact of this disease is not nearly as severe as COVID-19. It's a very uncomfortable disease. It can be severe in certain people, but at this point, the impact would be on significant illness, much less than what we see with COVID-19.
Thanks so much, Dr. Duchin. And before we wrap up, as you mentioned COVID-19, I was wondering if you just wanted to say a word about how things are looking here locally, any just brief messages for the public. And I know this is a different topic.
Yeah, well, if it wasn't for this novel monkeypox case, we would be talking only about COVID-19 today for good reason. We are seeing cases continue to be identified in high level here in King County and across the country. And we're seeing our hospitalizations bump up a bit as well. Nothing like what we saw with hospitalizations towards the peak of the Omicron surge, but lots and lots of people becoming ill. And so we have some really important advice for you. First of all, if you're not up to date on all your doses of vaccine, please be up to date, including both boosters if you're eligible, one booster if you're eligible. If you're eligible for a booster, get it. If you're eligible for a second booster, get it. That's the best way to avoid serious illness, hospitalization, and death. But don't be surprised if lots of people who either previously had COVID or previously been vaccinated do develop infection. And the way to limit infection and the associated risks, including long COVID, is to do the things that we've been doing all along. We are recommending people wear a high quality, well-fitting face mask in indoor public locations, and people pay careful attention to ventilation, understanding that outdoors is safer than indoors. Crowded indoor settings, poorly ventilated settings are high risk for COVID transmission. Spending lots of time in close proximity to others is high risk for COVID transmission. So testing also can be very valuable right now, particularly before gathering with people who are at high risk. Rapid tests the day of the gathering as close as possible to the time can help you understand if you've got an early COVID infection and not spread it to others. So COVID's going to be with us for a while. We may see, these surges, peaks and valleys over the coming months to years even. And we just need to use the tools that we have when necessary to both keep ourselves healthy and to keep those around us healthy. And those tools include masks, ventilation, testing, and if you're eligible for treatment, having a plan with your healthcare provider for Paxlovid antiviral treatment, or if you're immunocompromised, preventive treatment with Evusheld. Thanks for that opportunity, Sharon.
Absolutely. And I see one more question in the media chat just asking about possibility of any more information on travel history for the individual with monkeypox. I know that, we are being very diligent to make sure that we provide information that's really important for the public while also protecting patient confidentiality. But anything else you wanted to say about that, Dr. Duchin?
I can just tell you the case traveled to an area where other monkeypox cases have been reported where we believe the person was exposed, and we are in contact with that country just to let them know about this traveler and the exposures. But other than that, we don't want to release any details that might inadvertently lead to the identification of this person.
Great, thank you very much. And as always, if we gather more information that's important to share, we'll let you know. We sent out a press release just a few minutes ago. We will also put that up on our publichealthinsider.com right after this briefing. And once we're able to process the video, we will also post that for sharing as well. That'll likely come out tomorrow just because it takes some time to do that processing. If you have questions, feel free to reach out to us here on the media team, and we'll get back to you. So thanks again for taking the time to provide the information, Dr. Duchin, and to media for sharing this with the public. With that, have a great afternoon.
Thanks, everyone.